Welcome to today's video on the silent symptoms of a heart attack that women often overlook. Heart disease remains the #1 cause of death among women in the United States, yet most women don't recognize its early warning signs. According to groundbreaking research, up to 95% of women experience warning symptoms weeks before their heart attack. But those signs are so subtle that they're often dismissed as stress, fatigue, or just getting older. The tragic truth? Heart disease kills more women than all types of cancer combined, yet women are far more likely than men to overlook or misinterpret the early warning signs. This isn't about lack of knowledge. It's because women's symptoms can be very different from what we've all been taught to expect. Before we dive into the life-saving details, if you're new here, welcome to our community dedicated to women's health and well-being. Don't forget to subscribe and turn on the notification bell so you never miss vital information that could one day save your life. Comment below and tell us where you're watching from. We love connecting with women around the world who are taking control of their health. Today's video might change everything you thought you knew about heart attacks in women. These 9 silent symptoms are easy to overlook, yet recognizing them could mean the difference between life and death. 1. Unusual fatigue. That constant exhaustion you've been blaming on your busy schedule might actually be your heart's distress call. This isn't regular tiredness. It's a deep, unrelenting fatigue that makes even simple tasks feel overwhelming. A major study published in Circulation followed 505 women who survived heart attacks. An astonishing 70.7% reported extreme, unexplained fatigue in the weeks leading up to the event. Dr. Jean McSweeney from the University of Arkansas, who led the research, found women describing themselves as too tired to cook dinner or unable to make the bed without resting. When coronary arteries narrow from plaque buildup, your heart has to work harder to deliver oxygen-rich blood, draining every cell in your body. What makes this symptom so dangerous is how normalized exhaustion has become for women. Society often teaches them to push through it. If you're constantly feeling drained for no clear reason, and rest doesn't help, listen to your body. It may be warning you long before a crisis hits. 2. Sleep disturbances. Trouble sleeping before a heart attack isn't just about stress. It's often your cardiovascular system begging for help. Nearly 47% of women who suffered heart attacks reported unusual sleep problems in the weeks or months beforehand, according to research in the Heart and Lung Journal. Women describe lying awake for hours, feeling their heart pounding, or waking up suddenly gasping for air. As the heart struggles to circulate blood, your nervous system keeps you on high alert, preventing deep, restorative sleep. When sleep issues are heart-related, they feel different. They're more intense, often come with sweating or breathlessness, and don't improve with typical sleep hygiene habits. 3. Shortness of breath. If walking upstairs or doing routine chores suddenly leaves you breathless, don't ignore it. Studies show that over 45% of women experienced unexplained shortness of breath before their heart attack. This isn't just being out of shape. It's your body signaling that your heart isn't pumping efficiently. Women describe feeling like they can't take a full breath even while sitting still. When your tissues don't get enough oxygen, your brain tries to compensate by making you breathe faster. But no amount of breathing fixes a weak pump. If breathlessness gets worse with mild effort and doesn't improve with rest, especially when paired with fatigue or chest pressure, it's time to take it seriously. 4. Jaw, neck, or back pain. That nagging jaw ache or stiff neck you've been blaming on posture or grinding your teeth could actually be referred pain from the heart. Research shows women are far more likely than men to report jaw, neck, or back pain as their main symptom. It's not sharp or localized. It's a deep, dull ache that seems to move around. Because the heart shares nerve pathways with other upper body regions, oxygen deprivation in the heart can trigger pain signals in unrelated areas. This discomfort often comes and goes, making it easy to dismiss as a dental issue or muscle tension. If you notice persistent pain that appears with exertion and fades with rest, especially if it's new or unexplained, don't ignore it. 5. Nausea or indigestion. That indigestion that won't go away might not be your stomach at all. It could be your heart signaling distress. Around 39% of women reported nausea, bloating, or stomach discomfort prior to their heart attack. Because the vagus nerve connects your heart and digestive system, cardiac stress can show up as gastrointestinal symptoms. Unlike normal indigestion, this nausea often happens during exertion or stress, not necessarily after eating, and doesn't respond to antacids. Heart-related indigestion may come with fatigue or shortness of breath. Never assume stomach discomfort is harmless. It may be your heart's way of asking for help. 6. Anxiety or sense of impending doom. An unexplained feeling that something terrible is about to happen can actually be a physiological response to reduced blood flow to the brain. Studies reveal that about 1/3 of women felt severe anxiety or panic-like sensations before a heart attack, even if they had no prior history of anxiety. When your heart can't pump enough oxygen to the brain, your nervous system triggers a fight or flight response, flooding your body with stress hormones like adrenaline and cortisol. This causes sweating, trembling, rapid heartbeat, and an intense sense of dread. If you suddenly experience anxiety that feels different from your normal stress and it's paired with other symptoms, don't dismiss it as just nerves. 7. Lightheadedness or dizziness. Feeling dizzy or faint for no clear reason could be a sign that your brain isn't getting enough oxygen. Nearly 40% of women reported episodes of dizziness or lightheadedness before or during a heart attack. It might happen while standing, walking, or even sitting still. This happens because when your heart's pumping power declines, your brain is the first organ to suffer reduced blood flow. Heart-related dizziness tends to occur with exertion and may come with breathlessness or chest discomfort, and it can progress from mild to dangerous quickly. 8. Cold sweats without exertion. Suddenly breaking out in a sweat while resting or sitting in a cool room is another red flag. Studies show 39% of women experienced cold sweats during their heart attack. Some describe feeling clammy, pale, or drenched for no reason, while others confuse it with hot flashes. When your heart struggles to circulate blood, your body releases stress hormones that overstimulate your sweat glands. This type of sweating often appears with fatigue, dizziness, or chest pressure, and shouldn't be ignored. 9. Chest discomfort. Forget the Hollywood image of a man clutching his chest in pain. Women's heart attack symptoms often look very different. Only about 30% of women report chest discomfort as a warning sign. Instead, it may feel like pressure, squeezing, fullness, or burning rather than sharp pain. Women often describe it as a weight pressing down on the chest, tightness that comes and goes, or discomfort that mimics heartburn. Because women tend to have smaller arteries and microvascular disease, their pain can feel subtler and may appear off and on for weeks before a major event. These 9 silent symptoms are your heart's way of begging for help. Research shows that 95% of women experience these clues before their attack, yet most brush them off as stress, aging, or fatigue. Remember, heart attacks in women usually appear as a cluster of mild signs that gradually build up. If you notice several of these symptoms at once, or something just feels off, don't wait. Demand a proper heart evaluation, and never let anyone dismiss your symptoms. If you have risk factors like high blood pressure, high cholesterol, diabetes, smoking, or a family history of heart disease, your vigilance could save your life. Share this video with every woman you care about, your daughters, mothers, sisters, and friends. Recognizing these subtle warning signs could be what saves their lives. If this video opened your eyes to the hidden dangers many women face, type helpful in the comments below. Give this video a thumbs up so more women can discover this vital information, and don't forget to subscribe for more life-saving health content. Thank you for watching, and always remember, your heart is speaking. Listen to it.